And welcome to our combined board meeting and community discussion that will follow. If everybody could, the first thing is if everybody could please rise for the pledge. On three. 1, 2, 3. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. Mrs. Callahan, if you could do the roll call.
Certainly. Mrs. Johnson,
Here.
Ms. Weisberg,
Here.
Ms. Bays,
Present.
Ms. Brooks,
Here.
Ms. Epstein,
Here.
Ms. Gilliar,
Here.
Mr. Greenstein.
Here.
Thank you.
Thanks, Mrs. Callahan. Well, as I said, welcome to our meeting tonight. It's the business portion, or the business meeting itself, I should say, is going to run from 7:30 to 8. We have some important business that we do need to address, and a couple of important votes and a couple of important announcements that you'll see. After we go through the initial meeting, we will go right into, we'll adjourn technically, but we'll go into our community discussion, and you will have the opportunity to ask questions and get some answers. I will speak more about that when we get to that point in the meeting. That's about it for the moment. I see here we do have something quite important. We have some certificates that Ms. Brooks is going to announce.
Thank you. You'll forgive me, I have to read from my desktop. Under the direction of the advisors to the Science Olympiad team, Ms. Carrie Ann Lindstedt-Ura and Mr. Christopher Buckman. Oh, sorry, my screen just went. The Schreiber Science Olympiad team participated in the virtual Western Nassau County Regional Science Olympiad Tournament on March 20th, 2021. Schreiber team members earned medals in circuit lab, disease detectives, and water quality, and was the 6th ranked school at this regional competition. I am pleased to present certificates of excellence to the following Schreiber students whose achievements we honor and applaud tonight. Lokesh Vasanthakumar, Captain. Daniel Ruskin, Captain. Jackie Atchley, Diana Benedicto Jimenez, Tyler Duran, Nicholas Garcia, Solomon Graff, Anya Hassett, Silas Hokinson, Tyler Wang, Austin Hyde, Michael Katsageorgis, Ryan Kessler, Ian Lawrence, Justin Lee, Connor Maroney, Rigel Mummers, Tej Parekh, Taylor Shore, and Harrison Smetana. Let's give these talented students and their advisors a round of applause for their achievement. Congratulations, everyone.
Congratulations to all. Well done. Next item is a report of the superintendent. I think I'll go first to Dr. Shields for the enrollment report.
Yes, good evening. So our last enrollment report was completed just yesterday, April 19th, and we have 5,216 students. That's only 2 less than we had at our last meeting. And to give you an update on the kindergarten enrollment, we're expecting 391 students in the incoming kindergarten class, and so far we've reached 319, so that continues to climb up nicely. I'll provide more updates to you in the future.
Thank you very much, Dr. Shields. Dr. Hines, do you want to say a few words?
I do. Well, welcome everyone for joining us this evening. As many of you know, we are hiring many new administrators for next year. And tonight, the Board of Education will approve 2 of them, which we are very excited about. our athletic director, new athletic director, Nick Schratweiser, and our new ENL director, Priscilla Zarate. So very, very excited with them joining us for next year. So if you are here, Nick and Priscilla, just want to say congratulations. We are thrilled. And then I'll talk more certainly later on this evening. So thank you.
Thank you, Dr. Hines. I was actually going to pull that out of the consent agenda and congratulate them too. And now I'll just skip over it, but congratulations to both of you, both to Nick and to Priscilla, but welcome aboard. Okay, now we're going to, I'm going to move to adopt tonight's agenda. Do I have a second? Okay, Ms. Weisberg, Ms. Callahan, could you do the roll call, please?
Mrs. Johnson,
Yes.
Mrs. Weisberg,
Yes.
Ms. Bays,
Yes.
Ms. Brooks,
Yes.
Ms. Epstein,
Yes.
Ms. Gilliar,
Yes.
Mr. Greenstein.
Yes.
Thank you.
Thanks, Mrs. Callahan. Okay, we're now going to move to approve. Going to make a motion actually to approve the minutes of April 6, 2021, the board meeting, board executive session, April 13th, 2021, policy and personnel work session minutes, March 17th, 2021, Board of Ed curriculum policy and personnel work session of April 8th, 2021, and those were minutes. Do I have a second on that? Okay, Ms. Bays. Ms. Callahan?
Mrs. Johnson,
Yes.
Ms. Weisberg,
Yes.
Ms. Bays,
Yes.
Ms. Brooks,
Yes.
Ms. Epstein,
Yes.
Ms. Gilliar,
Yes.
Mr. Greenstein.
Yes.
Thank you.
Okay, tonight we're not having a discussion item because we are devoting the 8 o'clock community discussion will supplant what would have been a discussion item. So we're going to move straight to committee reports. First one is policy and personnel.
Hello. I have nothing new to report since our last meeting because we have not had another meeting since the March meeting, but the April meeting happens to be tomorrow at 9:30. The agenda, as always, is posted to Board Docs so the public can see it, along with the documents that the board work group will be discussing. Thank you.
Thank you. Budget and facilities. Beth.
Hi, everybody. Just a quick report on our budget and facilities. We have not met since our last board meeting, but I did want to give everybody an update because all over the news has been the information about our new state aid numbers and the increase in foundation aid. So just to make things very clear for those who are watching in the community who may have been following what Newsday is reporting and what other people are saying, as far as the additional amount of money from what we had budgeted or included in our budget for the 2021-2022 school year. These 20s are getting confusing now. Our anticipated state aid should be about $1.5 million more than we had in the budget that we adopted at our last board meeting for the 21-22 school year. That said, that budget that we adopted for the 21-22 school year included an amount taken out of our fund balance an amount of $2 million taken out of our fund balance, which the board had done to ensure that we did not have to interrupt or look at decreasing any of the programming that we offered. So given that, and also given the uncertainty, because some of these increases in state aid in the past have not always come to full fruition. We've all seen years where those estimated numbers just did not end up being the reality. The board has decided to continue with this budget and really see where we end up at the end of this year. Any excess funds that we have at the end of this year would go back into fund balance. And we will be able to use all of that information when we create our budget for the 2022-2023 school year. But in all in the job that we have to protect the district, to be fiscally responsible and protect the district's fiscal standing, we believe this is the smartest course of action for us to take, and we will be able to ensure that that money gets spent appropriately. I think we're all aware that we have a long list of roofs that needs to be fixed and other things. So we're certain that that money will be appropriated. Once we're certain it's here, once we're certain it's coming, and once we have that money, sort of in-house. All that said, I think we'll have further conversations about the rest of this year, next year, facilities and all of that at our next scheduled budget and facilities meeting, which is April 29th at 1 p.m. So I hope people will attend to hear more information and our continued conversation.
Thank you, Mrs. Weisbert. That was a excellent summation of where we stand, and we appreciate it. Curriculum.
Our last Board of Ed Curriculum Committee meeting was actually a joint curriculum and policy meeting that took place on April 8th. The subject was homework. If you missed it, though, you don't have to be too sad, because we all discussed and agreed that since this vision and mission work is underway, that this is likely the first conversation about homework, and that we will be planning for another one possibly this coming June, once we have a report from the Vision and Mission Committee. Our next curriculum committee meeting is also a joint meeting with policy. The subject will be gifted education. We hope you can all join us.
Thank you for that report. The safety and substance, that is Julie, have you had a meeting since we had our last one?
We have not, so we have nothing new to report.
Okay, thank you. Diversity Committee, that's me. We did have a scheduled meeting for April 28th in the evening, but we are going to adjourn that or postpone that pending further work with the NYU Metro Innovations in Equity and Social Change Committee. And we will report back to the community on that in a future date. Legislative Task Force.
Thank you. We have not met. However, the Legislative Task Force has been working on the revised guidance, the interim guidance for reopening that was released on April 9th. We will hear more about that later, so I won't take up time on that. But we have not had an actual meeting, but have worked virtually on some literature that we'll discuss later.
Okay, thank you. I just want to take a moment to introduce Analia Quispe, who's here, who people can see. She's part of the panel. She is our wonderful translator, who is a Spanish language translator who lives in the community. I'm sure many of you actually know her and have seen her at other times. Thank you, Analia, for being here with us tonight. And welcome to the Spanish speakers who are out there. We're very happy to have you as part of the meeting. Okay, the next item on the agenda is the BOCES budget vote. And this is a annual vote that we do. And it's two parts to it. The resolved, Board of Education approves the following two resolutions. And the first one is the BOCES budget itself. And the second one is to a vote. Well, I'll do the first one first. I'm going to make a motion to approve the BOCES budget for 21-22 as of July 1st, 2021 through July 30th, 2022. Do I have a second? Okay, Larry, of course. Our BOCES trustee. Ms. Callahan?
Mrs. Johnson,
Yes.
Mrs. Weisbert,
Yes.
Mrs. Bays,
Yes.
Ms. Brooks,
Yes.
Ms. Epstein,
Yes.
Ms. Gilliar,
Yes.
Mr. Greenstein.
Yes.
Thank you.
Okay, thanks. And the second part is a resolution on voting for 3 vacancies on the BOCES board. There happen to be 3 people running for 3 seats. So I'm going to make a motion that we vote for all 3. Do I have a second?
I'll second.
Okay, Larry, Mr. Greenstein, thank you. Ms. Callahan?
Mrs. Johnson,
Yes.
Ms. Weisberg,
Yes.
Ms. Bays,
Yes.
Ms. Brooks,
Yes.
Ms. Epstein,
Yes.
Ms. Gilliar,
Yes.
Mr. Greenstein.
Yes.
Thank you.
Okay, thank you. Now we are at the action items, and before we do the consent agenda, I just want to pull out, or not pull out, actually, just highlight, sorry. I want to highlight, it's, if you're following along with the agenda, it's on page 16, and we have 3 donations. The first one is a amazing donation in the amount of $50,000 that we've received from the Ed Foundation for the 2021 spring grants. And it is a wonderful, wonderful gift. And we can't thank the Ed Foundation and all of their supporters and their board, of course, enough. I just want to mention as a footnote, or mention for sure, that the work that we talk about, the NYU Metro innovations in equity and social change, that work has been funded in large part by this grant from the Ed Foundation, and we thank them. It's really going to let us move forward with the equity work in this district, and it's a great thing. So thank you so much. If anybody from the foundation is listening, and to all of you out there, thank you. The other gifts that I want to thank Mr. Clapp for a drum that's going to be used at the Weber Middle School in a music classroom. Thank you for that. And also a donation from Hearts for the Memory Project program at Schreiber. Thank you to Hearts, another great organization that raises money for the district. So thank you. Okay, so now I'm going to move to adopt items 10.1 to 10.6 on the action items. This is what we call the consent agenda. Do I have a second? Ms. Bays. Ms. Callahan?
Mrs. Johnson,
Yes.
Mrs. Weisberg,
Yes.
Ms. Bays,
Yes.
Ms. Brooks,
Yes.
Ms. Epstein,
Yes.
Ms. Gilliar,
Yes.
Mr. Greenstein.
Yes.
Thank you.
Okay, item 11 on the agenda, and this is regarding policy, and it's policy 11.1. I'm sorry, it is item 11.1. It's policy 2430, suspension of policies, policy 3230, administrative organization and operation. I move that we approve the following those 2 policies for adoption. Do I have a second? Ms. Brooks, the chair of the policy committee. Ms. Callahan, if you could do the honors.
Mrs. Johnson,
Yes.
Ms. Weisberg,
Yes.
Ms. Bays,
Yes.
Ms. Brooks,
Yes.
Ms. Epstein,
Yes.
Ms. Gilliar,
Yes.
Mr. Greenstein.
Yes.
Thank you.
Okay, great. We're actually running ahead of schedule. And before we adjourn and move into the community, I keep saying community conversations, what I mean to say is community discussion. I just want to mention that the next meeting dates, we have another board meeting on May 4th. And then, of course, we have a meeting on May 18th, and that'll be later in the evening after the budget vote and trustee election results are in. There will be a board meeting. Question for the board. There may be people that are tuning in at 8 o'clock because that's the official time that the community discussions begins. I don't know if we want to take a 9-minute break or just forge ahead.
I would say forge ahead is my opinion.
I don't think we should start the presentation until 8 o'clock.
I agree. I agree too.
I agree.
I think if we, right. Nora, maybe we could take a few minutes to work with Analia to make sure that all of our Spanish-speaking population is aware of how to get on to the meeting, to make sure that she can verify with them that they're on the Zoom so that they can ask questions.
Yes.
Aaliyah, are you able to communicate and make sure that everybody who needs to be on is on the webinar?
Yes, I can. Yeah, I'm just using the headphones and listen, the meeting in Zoom, and then I'm speaking on the Zoom, Google Meet.
And Analia, they know that if they want to ask a question, they have to raise their hand using the raise hand feature in the Zoom webinar, and we will call on them, and then you will translate the question they ask.
Mm-hmm.
Okay, great.
Yes, I can say that at the beginning. So you.
Sorry.
Say it again.
No, I was going to ask if how many people you have on listening at this point, if you can tell. You have a count?
Right now I have 3.
Okay. We may be getting more people at 8 o'clock, and the same thing for the community conversation discussion. Because I see we have 154. Then it went down.
There are 136 attendees. So there are 136 people other than the panelists that are logged in, ready to ask their questions or listen attentively, either or.
Ready for the presentation and to ask questions, yes.
Dr. Mioli, this is your time to tap dance.
Anybody wants to get up and get a glass of water? I'm sorry, I didn't mean to interrupt the dance. Anybody wants to get up and grab something to eat out there? Because we're not going to start for another couple of minutes.
Si alguien quisiera tomarse un momento para.
If I tap dance and there's nobody who's listening, have I really tap danced?
But we were watching, yes. I'm not going to turn off my camera, but I am going to go get a glass of water. Anybody see any good TV lately?
Well, I was thrilled to see the jury verdict on TV today, if we're just chit-chatting. And I know, Nora, you're going to be in agreement with me on this. It's wonderful to watch justice in America.
Yes.
And I took great pleasure in being able to tell my children about it. because they've been watching this whole thing. One of them said to me, if it's a good thing, why does your face look like it's a bad thing? And I said, I'm just overcome because I was so worried about this verdict and what could potentially happen.
Yes, I think everybody was worried about the verdict.
My husband's taking advantage of our break and making popcorn.
I should have talked slower, huh?
We were too efficient. It's okay. It gives everybody a few minutes to contemplate what they want to ask.
Exactly. Okay, 2-minute countdown. Feel like it's New Year's Eve. Watch the ball drop.
Okay, so I think when Mike comes back on, I think we could start it as 7:59. It's okay.
I think so too.
So when Mike is ready, I think he may have. Are you ready?
Is Mike back? Okay, good. I think we can start. For anybody who is just signing on, and for everyone who was here before, thank you for staying for the business meeting and being here. But for the new people, thank you for joining our community discussion. I just want to say a couple of words about the format. After I finish this introduction, Dr. Hines and will be giving a presentation. After that, we will have questions and answers. We request that the process for asking a question as usual, since we've been doing this, is you press the raise hand button or function rather on your screen, and Emily or Beth will call on you. It's one question at a time per person. You can come back for seconds, but we want to make sure that everybody gets a chance to ask the question. So we're limiting it to one question per person at a time. And the questions are the presentation and the purpose of this discussion tonight is to talk about the New York Department of Health reopening guidance and our district plan. So we would like the questions to be limited to that. As always, let's keep it respectful to each other. Please give your full name when you ask your question. And the Spanish speakers, I think we just went over it, but Analia, if you could just tell the people that are listening through with you that, raise their hand and they'll be called on by you and you'll translate for them. But I assume you've already told them that, so thank you. Okay, thank you, everybody. And I'm going to turn it over to Dr. Hines.
All right. Thank you, President Johnson. I'm going to share my screen. Okay. So before I begin, I want to make sure, and if everybody could do me a favor, just make sure you mute if you're a panelist so we don't get any feedback. I want to welcome everyone this evening. It looks like we have about 197 participants and it's rising. So I appreciate you taking the time out of your very busy lives to join us. I want to thank also our principals who are here, Dr. Pernick, Ms. Javelin, and my wonderful district office team for being here, as well as the Board of Education. And I know for a fact there is nothing more that the Board of Education and district office, and I could honestly say certainly our teachers and administrators and staff, wants more than anything than to bring our secondary students back full time. But as we know, school districts and departments of health in each county were thrown a curveball. And so I want to unpack what that looks like and what that means. Just give me a second. Okay. So first, let me start with some of the updates. The New York State Department of Health has updated their guidance to be in alignment with the CDC. And that's good news, because I think, many people were hoping that would happen. And this happened, or it happened to happen, on April 9th. And we found out, not just here, but everywhere in New York, in the late afternoon, early evening, which is never an optimal time to find these things out. And overall, the CDC recommends that all students remain at least 3 feet apart in classrooms where mask use is universal, regardless of whether the community transmission is low, moderate, substantial, or high, and that indoor quality should be improved by increasing outdoor air delivery and air filtration, which sounds reasonable. And prior to this change in the guidance, the district installed more HEPA filters to handle this increased population. So I'm proud to say we were ahead of the curve before this new guidance. Now, the changes in the guidance affects the Port Washington School District in the following manner, and it's really important that we understand this. The physical barriers, or the famous desk shields. The CDC no longer recommends, and I'm going to underscore recommends, physical barriers to mitigation when physical distancing cannot be maintained. So that means before, when the guidance stated that in order to go less than 6 feet, you had to have physical barriers. Now they have stated that you no longer have to do that. Here's another very important thing to understand: the high risk transmission, as far as what that looks like and what the indicators are. And I'll unpack that in a few minutes. The CDC has developed 4 levels of indicators and the threshold for community transmission of COVID. Now, Port Washington is classified in a county with high transmission, and therefore middle and high school students should at least be 6 feet apart if cohorting, and I'll unpack what that means, if possible. Now, it's really important, again, to understand, and I'll show the map in a minute, that almost 85%, if not higher, of New York State counties are designated right now in high transmission red zone. And that's a significant amount of our counties in New York. The way cohorting is defined is cohorting is where groups of students are kept together with the same peers and staff throughout the school day to reduce the risk of spread. And again, I'll discuss this in a few minutes. So when we talk about the New York State Department of Health guidance, now it makes school districts use the CDC indicators and thresholds for community transmission of really using this COVID tracker. And you'll see 4 different colors there. You'll see blue, which is low transmission. You'll see yellow, which indicates moderate transmission. Then you'll see orange, which is substantial. And then, of course, you'll see red, which is high. And the way they define that and classify that is by looking at, on a 7-day average, total new cases per 100,000 persons. And again, that's within 7 days. If it's over 100, then a county is classified or designated as red. And when this happens, it really, really restricts the ability for school districts, specifically at the secondary level, to do what we wanted to do before this new guidance came out. And I'll explain in a few minutes. So let's look at what this looks like. If you were looking at this tracker right now, this was taken yesterday, but it really didn't change much. To the left, you'll see what New York State looks like. And as I said before, you'll see either red or orange, which is substantial or high, but you'll see a significant amount of red throughout the state. And that really hasn't changed much over the past several weeks. And you'll see, again, if you look to the right, where Nassau County, Queens, and Suffolk County, it's red. And that, and by the way, we never had to use this before April 9th. We never had to look at this tracker, but now we do. So when we were forced to pause, there's a few things that we've done in the meantime. At the time of the updated guidance, the plan for the secondary level was to have the high school re-enter, as many of us know, yesterday, April 19th, and April 26th for the middle school. Now, since the guidance, we have put our plan on hold in order to evaluate any changes that need to be made. And in the event that changes are made that allow our students to return to the original plans, this will be implemented. So for the high school's plan, this was presented to the parents and posted online if plans change. And the middle school is prepared to present and field questions from their parents. Now, both schools will require a few days of remote instruction just to make sure that we can prepare the buildings to bring everyone back. And as you can see within all of these bullets, in addition to consultation with not only our attorneys, the school attorneys, the legislation task force, and thank you for everything you have done. You sent a letter to our legislators and to NYSBA, which is the New York State School Board Association. And from that letter, have been in direct communication with them to advocate for clearer direction and to understand the implementation impediments to bringing our students back all in. And again, especially at the secondary level. Now, the conversations have extended to the New York State Department of Health. I've actually contacted the governor's office. I've contacted the Nassau County executive, and in the process of setting up a meeting with the Nassau County, in order to discuss more local control over these issues. I've also had outreach to my association in New York State, which is the Council of School Superintendents. I have a quadrant that I meet with our Nassau County superintendents. We've had discussions with them. And I think most important, I've heard from our students, specifically our seniors, who are incredibly upset about this change and this sudden change. And those are probably some of the most painful conversations I've had because I understand what they're feeling. I can't pretend to be a senior, but I know that they were excited to come back, and not just our seniors, but certainly our middle school students and certainly the rest of our high school kids. So adjustments that have been made since we've been on hold. Now, for the desk shield removal, and I know that, for many of our students, they didn't like when they were there. Well, with the old guidance, that's what we had to do in order to bring all of our kids back, secondary students back, just like we did at our elementary in October. We were following the guidance at the time. And so based on the feedback and observations from staff and students at the secondary level, it seemed like the desk shields were creating an obstruction to learning. And since they are no longer required by the guidance, the decision was made to begin, and we have removed them all at this time. The process did take some time, but I'm glad to say we took them down in a timely manner. I want to thank Jim Restano and his staff for doing so. Very much appreciative. At the elementary level, we consulted with our attorneys, who have advised that under the updated guidance, we are in compliance if we choose to leave the shields up. Therefore, as I've thought about what this means for our students and for our staff, we are going to leave the desk shields in place for a host of different reasons. One is, I believe it's important that we honor the fact that our kids feel safe and our staff feels safe. So from a safety perspective, it's important. I also believe if the shields were removed in this time, we will probably most likely have parents that would like them there because they've been there all year and they're used to it, and same with our staff. So my recommendation for right now is that the shields stay in place, and less change for our youngest learners, I think, in a really tumultuous year is in the best interest of them. So therefore, they're staying in place. As far as our next steps, there's quite a few things that we're looking at the present moment. So cohorting at Weber. Now at Weber, as many of our parents know, while our students are podded and our faculty travels in the pods, there are a limited number of students that must leave the pod for services or some electives. We're working with our legislators that are in constant contact with our attorneys to evaluate if Weber is actually considered a cohort. And I'm happy to say that the building level committee at Weber is meeting sometime this week to revisit this and to see what we can do at Weber, and we will update you in short order. As far as the return of our 12th graders, and as I said before, I've spoken to say many of our seniors, but I've certainly spoken to some of our seniors who have voiced their concerns, as it is really important that they want to see each other, certainly before they graduate. So this is where it's a little trickier, because at the high school level, there is really no way that we can fit all of our students back at 6 feet apart and beginning to cohort students at this late date. It doesn't seem feasible at this moment. It's very difficult to do. And I'll talk about in a few minutes, we hear what other districts are doing at this moment, and I'll address some of those things in a second. But we are focusing our attention at trying to do something for our seniors at a minimum, since again, this is their last year of school. We have several innovative ideas that we're looking at: schedules, spacing, and also looking at some of the factors that need to be examined to see if we can make this take place. And I'm hoping to have some news shortly. I want to thank our parent council. Our parent council has really been working on a partnership with the secondary level HSAs to send out a petition to support the advocacy and changes that we are asking for, so that we can bring our middle and high school students back. And it's at change.org. Planning for September, of course, our district and school-wide committees continue to meet to ensure that we will have a plan in place before our students return to school in the fall. And the community feedback process is incredibly important to us as we move forward. So throughout this process, we've had meetings such as this. We've been using Thought Exchange as a valuable tool to elicit feedback from our staff and from our community. As always, we're working very closely with our Parents Council, our HSAs, PTAs, and we're continuing our committee meetings in place. So let me address some of the things that I've heard, probably the top 3 things as far as questions or thoughts from our staff or from parents who have reached out to me or reached out to our Board of Education. We know there are some school districts before the new guidance came out had their secondary students in. And when they did so either with desk shields or they were 6 feet apart, and they continued to do so. We have some school districts, and I'm sure some of you know which ones they are. I'm not going to name which ones they are, that are actually not cohorting their students, and they are less than 6 feet. And some of you may be asking, well, how can they do that? And the answer is, well, they're choosing to not follow the guidance. And then there are some school districts that are adhering to the guidance, whether it was before with the old guidance or the present guidance that we have right now. And the reality is they are 6 feet apart, and it didn't faze them one way or another. And there are some school districts like ours that were about to bring our secondary students back. And some of them have paused like we are, and some of them have moved forward thinking they're just going to disregard the guidance. For us, in the forefront of all of this is keeping what's in the best interest of our students. That's always been the goal. And for some of our students who may be listening right now, for some of our parents and community members, that has always been the goal and will continue to be the goal as we unpack this. I know our administrators are working, when I say our administrators, our principals, specifically Dr. Pernick and our assistant principals, and same thing with Ms. Javelin and her assistant principals, are trying to think of creative and innovative ways to still make this happen. But we can't do this, stay on pause forever. There is a point of diminishing returns. I know for a fact, the longer that we are on pause, it creates anxiety, lots more questions pop up. So my recommendation is, my hope is we will have an answer for all of this by the end of this week. I think if it goes past the end of this week, it's too much. But we will continue to advocate. We will continue to look at everything to try to make this possible for our secondary students. And if our secondary students, again, are listening and watching, I hope you know that we had every intention to bring you back in a safe way. This Board of Education has dedicated a lot of resources to ensure that happened before this new guidance came to be. They continue to advocate to make sure this happens. And as this is happening, of course, we are planning for what next year looks like and what that means. So with that said, that is really just a very broad overview of not only why this is happening, what we've been doing since we've been on pause, and what we're hoping in the very short future as far as what we can do moving forward. So I turn it over to you, President Johnson, and to the best of our ability, we will answer the questions that our community has. I hope this answered some of the questions, and if not, then we will certainly do our best to answer any questions that may still be out there.
Dr. Hines, can you stop sharing screen?
I can.
Okay, so we do have some attendees that are ready to ask questions, but I'm going to start the process, but I'm going to ask, there's some such as Kat, if you could just please give us your first name and your last name, and then you can unmute yourself, please. Kat?
Excuse me 1 second before Kat starts. I don't know if Kat was heard before, but one of the requests that we have is that each questioner identify themselves by their first and last name.
Okay, Kat went away. So I'm going to allow Kim P to speak. Kim, if you could just give us your last name and you can unmute yourself.
Hi, it's Kim Pastelov. How are you? I just wanted to talk about the sixth graders who have been in cohorts all year and why the process of getting them back in school wouldn't be easier since they're already in the cohorts.
So I'm trying to understand the question. The question is, can we just bring our sixth graders back right now because they are in cohorts?
Not just bring them back. Sixth graders in general, I feel like in a lot of districts have been in school since September on Long Island, but they are in cohorts. It's actually been a struggle. I mean, they've been sitting in cohorts all year in the same room through lunch. And so aren't we a step ahead there now since they have to be in cohorts in order to come back?
Oh,
I know we're looking at the seniors, which I think is amazing, and I really hope that happens. I'm just thinking now to the sixth graders, if there are ways to bring these young students back into the school. These kids don't even know where the nurse is. They don't know where the library is. You know what I mean? So
I do. No, and you bring up a really valid point. For our sixth graders to think where they were in fifth grade in March when this hit, and then where they are right now in sixth grade. They've been through a super difficult transition going to a new school. There's no doubt about it. What I can say is when the Weber committee looks to reconvene, we're going to look at ways to see if we can still bring our 6th graders and 7th graders and 8th graders. We wouldn't just bring, I don't think, one grade level. I think we're looking to potentially, if we can, bring all 3. But you bring up some incredibly valid points for our, I will say, youngest learners at the secondary level moving forward. So I appreciate you sharing that perspective.
Okay, next speaker is Michael J. Frivola. So Michael, if you can unmute yourself, please.
Hi, yeah, thank you. I through my connections in the community, I'm aware that for a long period of time now, there have been effluent samplings going on with the water authority, and that there are, essentially, if you followed this as closely as I have, starting last spring and going through the last year, one of the ways that you can track potential surges in a local community is how much is showing up in the wastewater. And with regards to Dr. Hines' list, I saw a lot of different people that were being spoken to. And one of the people or one of the entities I didn't see any speaking having done with is, has there been communication with the local water authority? Because my understanding is they're sampling basically on a very consistent basis. And if it turns out, for example, that the peninsula is showing a very low, effluent rate, that corresponds to there being very few people that are either knowingly or unknowingly infected, which means that literally you can predict how safe the community is, and you can also predict a surge. And I was just wondering, has anyone talked to the water authority about that? Because that could be a way that you could help to safeguard any opening by having that predictive capability there that's been shown time and again in other communities. It works in terms of getting ahead of any surges. Thank you.
Thank you, Mr. Favola. That you bring us some great points. And so I think some of the difficulties that school districts are faced with right now is that they are forced to only look at the COVID tracker that the New York State Department of Health has focused on. That is the impetus, or I should say, that is the metric that we have to use. Is that 7-day average county-wide. And you bring up a really valid point. What's happening potentially in Freeport or Bethpage or somewhere else in Nassau County can influence, of course, what's happening all across in Nassau County. And we're not looking at hyper-local data. We're looking at Nassau County data, which is vast and large. And so, Dr. Allen, is there anything else that I'm missing as far as, this tracker, and we're not looking at, very local, up-to-date data? This is part of, I think, the conundrum that many districts are facing right now.
Yes, that's part of the problem. So, we have that COVID tracker. That's really what the guidance has told us that we should be looking at. There are other trackers out there. There's one from the New York State Department of Health. There's also one from New York Forward, but they all the most recent guidance, I should say, points us right to the CDC tracker.
Well, what I will do is I will reach out as far as the data that you're speaking about. And I think anything else that I can have with me that I can arm myself with, we will certainly use. So if maybe you could email me that information, I would very much appreciate that.
Okay, next is Paul Fox. Paul, if you can unmute yourself, please.
Yes, thank you. First, I just want to thank Dr. Hines, all of you guys, and everybody that's been working so hard to try and get our kids back to school. I think that's it's a goal that we all have that are on this call. So we appreciate the efforts. And second, just to sort of follow on that last call, it sounds like you guys said that there are a number of other school districts that have, for lack of a better term, disregarded the guidance and gone back. And so I wonder why it is that in our district, we are only strictly following those specific guidelines rather than looking into, more localized category of whether there's a lot of community transmission. Like you said, if something's going on in Freeport, that's not necessarily going to affect us. I know how horribly this has affected my 6-year-olds. I've got 2 kids in Catholic school that have been full-time this whole year, and they're doing phenomenally well. My 6th graders are struggling significantly, and I'm sure you're seeing that with other kids. So, is there a way that, or is there a specific reason that we haven't followed those other school districts? And is there a way that we can, going forward, use the more localized data?
Thank you, Mr. Fox, for those comments. In our legislative campaign, we have asked for more local control. That is something that's really important to us as a school district. I will speak, I can't speak on behalf of all of the school districts that are in right now, but they were in either transition of bringing their kids back during this time. Even my home school district, they already had 3 grade levels back, and then yesterday they brought in the last grade level. And at that point, since they had so many grade levels in already, they weren't going to backtrack and then make everyone, go back to hybrid. That, I think, is the common theme or the common story for many of these school districts. I think many of the school districts that were about to go in, actually, like what we're doing, they went on pause. So we will continue to advocate for the local data, which I think for us is incredibly important, and then we can make those decisions to bring our kids back. But this guidance needs to change, and we're hoping it changes before the end of this year. And then, of course, we're hoping it changes certainly before September, when the school year begins, which is a whole nother story. Right now, we're focusing on our kids right now, but I appreciate your thoughts and sentiments.
Leslie Cohen, please unmute.
Hello?
Yes.
Okay, good. Mr. Fox, I kind of took my question, but I'm going to actually kind of ask it. Why is it that the other districts were ahead of us? In the sense that Roslyn, Jericho, Manhasset, Calhoun, that's just as big as Schreiber, we're all in. Why were we behind the 8 ball? And why can't who's deciding that we need to listen to the CDC? It is imperative that our students get back in person. I'm very passionate about this. It's who's in charge? Why can't we have a community vote? And if the majority of the community wants in person, why can't we follow suit like our surrounding communities?
Well, thank you, Ms. Cohen, for your comments and question. Well, first and foremost, that would be me, who's running and facilitating, trying to make this happen. For as many school districts as you stated, there are an equal, if not more, number of students, or school districts, I should say, that are still in hybrid that are in the surrounding area, without me naming who they are. And I'm not saying that we were behind the curve. I think there was a process in place. We were speaking about bringing our seniors and our 8th graders back. We were working on that since January. I know Garden City was moving toward bringing their secondary students back starting in February. But right now, with the planning that was in place, and it's not just Schreiber, Weber is a very different middle school, I think, than other middle schools and other school districts. It's a massive middle school. So there's a lot of things to consider, but I thought we were ahead of the curve, to be honest with you, as far as moving that forward in March, because we really started rolling this forward in March. And then there's the procurement of desk shields that we had to do, and that doesn't happen overnight. So there was a lot of planning to doing this. But as far as not following the New York State Department of Health guidelines, I can't say that I would recommend going against it. Now, are there ways that we could dig deeper into what this looks like for us and try to be creative in bringing our students back? We will continue to do so, but I don't think it's a good idea to just disregard it.
Jackie Kepke. I'm sorry if I didn't say your name right. Unmute, please.
It's actually Matthew Kepke. Again, thank you everyone for all the work that you've done. It appears that there are some things that are out of the district's control. One concern that I have is if we're in the same situation come September, What has the district done in terms of planning on the upcoming budget for the potential need to build additional space to house some of the students, be able to bring them back?
Great question. Those are the things that we're working on in building level committee. So before this year ends, we will have a plan in place. And again, before this guidance, that was part of the plan too, is whatever we had in place before this new guidance came out, that was going to be our plan come September. So we're still making those adjustments as far as what that would look like for our kids. And for some of you who have been driving up to Schreiber and to Weber, you will notice we have lots of canopies that are outside. So we're looking to be creative as far as our space is concerned by having these canopies, which certainly helps. And that is part of the conversation amongst our committees.
Barbara Minadeo, I believe. Please unmute.
Hi, when you speak of cohorts at Weber, how do you control the outside of school cohorts? So kids are in dance class, kids are in sports, kids are play dating. It's hard to maintain a cohort in a school if you can't control a cohort out of school. Thank you.
Well, that's a very good observation. That is very true. We can only control what we have when our students are within our school buildings or when they play sports. But yes, over the weekends, certainly and if they have dance class or anything else, those are things that we can't control. But what we do know is when our kids are in school, we've done, I think, a really good job making sure there's very little, if to no, in-school transmission. And so I am very proud of that fact. But those are the things that every school district has to contend with, unfortunately.
Irene D'Antonio, please unmute.
Hi, good evening. There were a bunch of references to other districts that are breaking rules regarding reopening school. And also there are certain rules that our district can't meet in order to open. What rules are other districts breaking and what rules can't we meet to bring everyone back full time?
So I just want to be clear about the school districts. I won't say breaking rules. They're choosing to potentially not follow the guidance as far as the social distancing within the classrooms. And so that's the thing. If let's just say hypothetically school district A brought their students back less than 6 feet and they didn't cohort at the secondary level, what are they to do now? So they have to answer those questions. I don't know what they're doing.
So what is the penalty from the government if they break those rules? Are there any penalties?
Well, I think for us is we don't want to find out what the penalty is. And I think just as important, we want to make sure that, God forbid, something does happen to any of our students or staff members, that we're not held accountable for that. So there's a lot of different things we have to focus on. But the guidance is, and again, it's really more than guidance. It's things that school districts have to follow. And I don't want to speak on behalf of other school districts. I know for us, we have a space issue right now. If we're going to bring all of our secondary students back, we just feasibly can't fit all of our Schreiber and Weber kids in at 6 feet. It's just, it's impossible. In some school districts, it seems like it is possible. In other school districts that are already in before this new guidance has to figure out ways either to make that happen or to do something else. But for us, it's the space concern. It's a major, while we are in the red zone, let me quantify that. While we are, as a county, we're in the red zone.
Kim P, is this the same Kim P that spoke earlier?
It is, yeah.
Okay, I'm going to ask you to just hold off because I want to give everybody a chance.
That's fine. Yeah.
Thank you. Amy Lauria, if you could unmute.
Hi, thank you so much for taking my question. First off, I want to say how much I appreciate you following the CDC guidelines, especially right now while we're in the red zone, as well as walking very slowly in bringing our kids back. And I'm sure we've all learned so much this year and last year to get ready for September. My main question is, now that 16-year-olds can be vaccinated, I know that you can't mandate it and it's not state mandated, but would it ever be considered highly suggested, especially for the seniors, so the kids who do get vaccinated, it'll make that decision easier for you to bring the kids back once they're vaccinated?
Thank you, Ms. Luria. Great to hear from you. Yeah, that is something we are looking at, and I actually, one of our seniors actually made that recommendation to me, as far as, let's see how many of our secondary students who are 16 or over are vaccinated. There's a lot of, and I'm not making excuses, there are a lot of other complexities that come along with that when it comes to scheduling and where kids are sitting and so on and so forth. But it is something I know Dr. Pernick is looking at, and it is a really good suggestion. And I think to extend that, thinking about what that looks like for September, what percentage of our students will be vaccinated at Schreiber, before we begin the school year. That's information I think we will definitely certainly need but certainly over the summer. So I appreciate that. It's something we'll certainly explore.
Jamie Lowy, please unmute.
Hi. Irene actually asked my question in terms of, is this guidance or are these mandates, and what are the risks if we don't follow? And you answered that part. But after looking through the guidelines, the guidance, it's clear that the guidance uses language like to the extent that it's possible, or recommends, or suggests. Doesn't Weber cohort to the extent that it's possible, meaning we are mostly cohorted? It's frustrating because, as other people have referenced, all of these other districts that we frequently compare ourselves to are able to go to school, and our kids are still at home. And particularly in the middle school, they are really cohorted to the extent that it's possible. And with a few small changes, particularly in the 6th grade, isn't it true that they'd be mostly, like almost entirely cohorted? So I don't understand why it has to be all or nothing. If one grade can be looked at individually, why would we not do that? And I guess I just don't understand what the risks are. These are guidelines. Guidelines are suggestions. The camps this summer, they followed the guidelines, and all of the camps followed them differently, but none of the camps followed them perfectly. So I guess my question is, why are we not paying attention to the extent that it's possible and acknowledging that our district has done a great job?
Thank you for your question. I'm not going to say it's the burden of the superintendent. It weighs very heavy on me, and it's not a burden. It's the ultimate responsibility to make sure all of our students and staff are safe. And with that, and for those of you who may know me, I like to push the envelope. I like to find ways around certain things and making sure we, of course, do it in a legal way. When someone suggests, I'm not saying you are suggesting, this is more than guidance. We are in a pandemic. We see a deadly disease that's out there. And believe me, I know when I look at our 6th graders or 7th graders, doesn't matter what grade, but I understand 6th graders. We have our committee meeting this week at Weber, and we are going to see if there's anything that we can do to make this happen. But please know that we take this very seriously, and I'm not being flippant about, just following this to a T. We want to make sure we're doing this the right way. And in regard to the other school districts, I want to be very clear. More than most, we're either transitioning or we're in already. They weren't in our position when we were about to go in, and it's a huge distinction between the two. So with that, we will continue to look at what we can do with Weber, for sure. Thank you for that question.
Nina Bose. Please unmute.
Thank you. Thank you, Dr. Hines and Emily, and with deep appreciation for everything that the school district, the schools, the school board, that all of you have been doing for so long. I'm just looking at the school calendar, and I think we have 9 weeks left, plus a few days this week. And at what point, and I think Dr. Hines, maybe you started to answer this in your last response. At what point might we be better off continuing with what we know this year, where I understand that hybrid is not ideal for many, but for some students who have adjusted to this and maybe would like to kind of continue with where we are as we look ahead to finals, graduations, celebrations. There are so many things to come. It feels like a very big change in a very short time when we have so many big events and school work, kind of celebrations and work that are due, that are coming up. Might our energy be better spent on trying to make the final weeks of school as strongly as enjoyable as possible and as safe as possible, given our current constraints? Thank you.
Thank you for that question. There's one thing I've learned, well, it's been more than one thing I've learned this year, that's for sure, is that every time there is a recommendation or decision, there are some people who are happy and some people who aren't. You know, some people who want this and some people who don't. And so when I made that recommendation to the board and we were forging ahead with bringing our secondary students back, there was certainly, you know, parents who, and some students who did not want that to take place. I am of the mindset that we will continue to try to bring all of our kids back, but there is a point where I think we need to stop and then focus on next year. And that will happen sooner than later, for sure. But I don't think we're done turning over every single rock as of right now. And until we do that, then I'll make that decision and recommendation to the board.
Bill Lang.
Hi, this is actually Mary Pat Lang. Thank you, Dr. Hines. I just want to say that I am also a teacher, so I appreciate every effort the district has made in attempts to get the kids back to school. I work in Garden City. All of my, elementary schools have been in since the first day, where we lagged there a little bit, which I was grateful that you guys were able to make that happen. But Garden City has been back since the February break, the Monday after February break. We're all in the same zone. I know that you're talking about this. I just want to kind of get an idea of why, with the 3 feet versus 6 feet, that you're still in that mindset that you can't get the kids back into school, because that's been a big shift in our district, how we could get our kids in safely. And we also have a brand new building in the Weber Middle School building, which is not being utilized as far as I can see in any way. When you have a new building and that construction that's could be used in any capacity, I'd just like to kind of get your feet on why that's not being used to separate kids and have them spread out. And my last question is just, we haven't had sports and we haven't had any spending in that capacity. What in the budget that you're planning to propose, where is that money gone? I mean, we haven't brought any, real sports back for any of our kids. We've had a few major things put in, but where are you spending that money in your new budget?
So I'm going to ask Ms. Javelin, if you wouldn't mind just talking about the space, because I know you know the space in Weber very well as far as some of the reasons why, and then I could talk about the budget from there, if you wouldn't mind.
Sure. So the new wing, which we call the CAW, is being used. We have classes that are in there 9 periods a day. There's 4 rooms in that building, and they're used for 9 periods every single day.
And as far as the budget, I just want to make sure that, so for this year, for our middle school student athletes, we have intramurals that either have rolled out or will be, they're rolling out soon.
Rolling out, yes.
Couple weeks,
rolling out.
right? Yeah. So when is that, Beth, if you don't mind me asking?
Oh, sorry. We were going to start it rolling out on the 26th when we were coming all back in. So the postings just went out. So it should be starting, I want to say around the 26th. I don't have the exact date on the top of my head.
All right. So then when we talk about next year, though, my understanding is that, yeah, we're moving full steam ahead with our middle school sports. So nothing has changed from a budgetary standpoint when it comes to our student athletes at Weber.
Okay, Gary Fishman, please unmute.
Sure.
Hi, Dr. Hines. For those districts that are not following the guidance, have you been able to understand the transmission rates? Because I would think the data there in the surrounding districts would be telling, if they're not following the guidance, whether or not the virus is actually transmitting or not. Do you have access to that data?
No, and that's a really good question. But if I was to surmise that, to think of what this would entail, I think they're minimal. So, but again, what they've done and where they are is a totally different place than where we are. And so they have the opposite problem in some ways. I know for a fact, without naming names, there are some superintendents who are like, oh my gosh, all right, we are not in compliance. What are we going to do? And actually reference Port for being in the position that we are in a positive way, knowing that we haven't moved forward. But as far as that local information, I don't have that. But when I meet with my colleagues as a quadrant and in a county meeting, which I have, I believe, on April 26th, from a county perspective, I'll bring that point up and see what I can find.
Okay, Beth Silfen, please.
Do you hear my question?
Yes. Hi. Hi, can you hear me?
Yes.
So first, just a comment. What I'm hearing, Dr. Hines, several times now, is that the districts who are back, the reason they're back is that because they were a little ahead of us and they had started their rollout, so they got to continue their rollout. But because we were behind, we now have to stay behind. And that's just a little disappointing to hear, that there's no effort now to try to get ahead and to catch up. And now my question is, the parent of a senior whom they have maybe 40 days of school left, has there been any effort made to sort of think creatively for the seniors? So many of those classes don't have a lot of kids in them. Maybe you could bring just the seniors back with their desks 3 feet apart. So many of them are vaccinated. Any parent who doesn't want to send their kid back or who feels uncomfortable, those kids can stay home, but let the seniors go back. I suspect that you're not going to run afoul of the rules or the guidelines or whatever they are with those seniors in their last 40 days of their Port Washington education.
Thank you for sharing your thoughts. Dr. Pernick, if you don't mind me asking, as far as things that we're looking to do for our seniors, without getting too ahead of ourselves, I know you've been working hard with our assistant principals. Do you mind just maybe sharing an idea or two as far as what we're looking at?
Sure. First, I don't want to miss an opportunity to plug that any students who have been vaccinated, if they can bring a copy of their vaccination card to the nurse's office, we certainly need that on file. There'll be more about that coming out soon enough. So right now we're looking at a couple of different models where we would be able to bring seniors back and keep them cohorted safely. So one of the challenges we have in a classroom is that we have many classes where seniors attend with juniors and sophomores. So to achieve that goal, we would have to reorganize classrooms so that the seniors were seated 3 feet apart from each other, but 6 feet apart from the other students who are in the classroom. And I had gone around with assistant principals the other day to measure out some of these classes, to map them out. A couple of our classes just could not sustain, given the breaks and how many seniors and how many non-seniors are in the classroom. And others would, because of the numbers, would relegate the non-seniors to the very rear of a classroom because of, again, the breakage. So that part is just complicated to bear out in terms of classes. But we're also looking at models where we might bring seniors back just to large spaces where they could be together and not, let's say, attend class in person. Maybe they attend hybrid, but they're in the school together anyway. So we're looking at things like that, but we're also spending some time trying to figure out
what constitutes breaking the cohort. And we're trying to poke holes in each of our ideas and then ask questions to interrogate ourselves about what would a break in the cohort mean if a student goes to the cafeteria to get lunch and now is intermingling with 9th graders, 10th graders, and 11th graders? Have we broken the cohort? And then there are a dozen other questions like that. So we are trying and looking at a number of models where we would be able to bring seniors back, but they're challenging.
And just to add, anything that we do, we would certainly share with the Nassau County Department of Health to make sure, it's appropriate with what we're doing. But we're really looking at everything we can do to bring our seniors back.
Okay, there's a Paul, no last name. Not Paul Fox, Paul, just Paul. So if you could please give us your last name and unmute yourself.
Yes, hi, this is Paul Gordon. Dr. Hines, I know this is difficult, but I'm wondering what your best estimate outlook is for September as of right now.
Thank you. I missed your last name. My apologies. Thank you. So my best guesstimate, I spoke to, there's an organization for school superintendents in New York State. I spoke to the lead attorney shortly before this meeting, around 6 o'clock, and I asked him the same question. I said, I think we're certainly looking at, before the end of this year, what are some of the things that may happen? But more important, I will say what's it going to look like in September. I think there are a couple of things that work in school districts' favor. I'll say our favor, I believe. One is we'll have more kids vaccinated. We'll certainly have more adults who are vaccinated, meaning our staff members. I think that will help. We're hoping we'll have more of a herd mentality where the transmission rate will be much lower within Nassau County, which will be out of the red zone. That would be ideal for sure. So if I had to, I'm not promising, but if I had to guess, I think we will not be in the red, and my hope is we'll have more students, secondary students, vaccinated. That is being very optimistic, but of course we have to plan for the worst and hope for the best. And what I mean by that is, even if it is the worst case scenario, we will certainly still have a plan in place.
Okay, so I don't have any new questions from anyone, so I'm going to go back now to Kim P. So Kim, you may ask a question again.
Hi. Okay, I'm gonna come back to my original question. It's Kim Pastelove. I have a son who's a sophomore in high school and a daughter who's in 6th grade. I don't really understand how we can look at every grade the same. They are completely different. My son, he could be home in hybrid the rest of the year. It's okay. He's in 10th grade and he's of age. When you have 11-year-olds that have been, number one, put in cohorts the entire year, nobody else has. So now we've looked at them differently. We said we can't look at them differently, but we did, because they got put into cohorts all year and had to stay in their classrooms the entire day. That they suffered, actually. I have to say, a lot. They went through that all year. They should be looked at differently right now. They should be one of the first ones to be looked at. They are also the youngest and doing real school. The parents have to teach them math and science, and they only have been in school 2 days a week. And if there was any problem with a COVID situation or anything else, they were in school 1 day a week or no days a week. We finally got the Wednesdays added back in 2, 3, 4 weeks ago, which they get one every other week. It's not enough school for the 6th graders. And it's very concerning to me after listening to this meeting. It sounds like there's a lot of obstacles going on right now. Personally, I don't think everyone should suffer. If you can get the 8th graders back in, get the 8th graders back in. I don't care that I don't have an 8th grader. Get some kids into the school. The school is big enough to hold a grade. I think if you do the analysis on who's really suffering, I think you can learn a lot. Like if you're saying by the end of the week, if we can't figure it out, then you know what? We're just going to move on to next year. No, there are so many creative things we can be doing. And personally, as a mother of a 6th grader, these children are suffering. I'm getting 60 texts while I'm sitting on the phone right now. They are different. They cannot be looked at the same. My daughter goes to camp. She has 7 friends on Long Island in 6th grade. They have been in school since September 4th. They never missed a day. It's not the same. You can't look at it like that. we can get creative and and I feel the same way about the seniors or whatever grade it is. Let's get some kids back safely if we can't get them all back.
Thank you for sharing that. I'm not sure what your question was, but I don't think I disagreed with you that sixth graders are different or they're not different. I know they are. Being a former elementary teacher and principal, I totally get where you're coming from. I do. And I can tell you that Miss Javelin and certainly her team is looking at everything. And like I said, they're meeting tomorrow to see what we can do. If we can bring kids back, we will. But we have to do so within the guidelines of this guidance that we have. But listen, as a parent, there's nothing that you are saying that I disagree with, except for the fact that we're not trying to be creative. I think if anybody is listening right now and they think that we're not trying to be creative, I would say that's not accurate. We are trying everything. We are speaking with lots of people to try to make this happen. And ultimately, it's my responsibility to make sure that it does. So I've pushed our administrators, and we will be pushing our committees to see what else we can do. But I hear what you're saying. I'll just leave it at that.
Okay, I have Denise. You may speak. Please.
Hi, hi, Denise Paredes. I have a question about the elementary desk shields. I know it was sort of glossed over that, parents feel more comfortable with them, the teachers like them. What is the efficacy of them if we have any data on that? And also, is it just a matter of comfort? I mean, they're no longer recommended. The new guidance says that they will prioritize and ventilation, which I know we have. We have the windows open at the elementary level. They are, they're a hindrance. The kids don't love them. I think a lot of the kids are super little and they don't really complain because it's what they know. And also the point of not changing things for them mid-school year, I appreciate. However, sometimes, if you're giving them more normalcy, I don't think you would get, I think it's different than giving them more restrictions in the middle of the year. So I'd just like to know sort of what was the thinking and, could that be revisited at any point?
Yeah, thank you. This is an interesting one because we're still in compliance right now with the new guidance. And I believe and I've spoken to our administrators, I've spoken to some teachers. Here's what I think would happen. You have parents and teachers or staff that want them gone. You have parents and staff that are maybe in the middle, and you have parents and staff who will be really upset if they're gone. If we remove those desk shields that have been there since October, and I'm not saying everyone's excited by that, but I think there will be parents and staff that will be really upset about it. And I don't want to do that if we don't have to at this moment. I think our kids have been through enough at the elementary level. I think if we make that change, some will be happy, some won't. I just don't want to take that chance right now if we don't have to. Of course, I'll still consult and I'll speak with our elementary principals to get their thoughts and feelings about it, and certainly ask them to engage with their staff. But as of right now, that's what I feel most comfortable with.
Okay, Jordan Wolf will be asking the next question. There's several people that are in line who have already asked the question. I'm just going to encourage, there are 205 attendees. If you have a question, please ask it. So Mr. Wolf, you may unmute yourself.
Hi, thank you so much. Just to follow up on Ms. Paredes' desk shields. From what I'm understanding, it sounds like when it comes to making this decision on the desk shields, you're prioritizing whether or not it will make people unhappy. However, when it comes to whether or not you are opening the middle and high schools for 5 days for everybody, you're holding to the guidance. Why are there two different standards being applied here?
Thank you, Mr. Wolf. I'm not sure I understand your question, though.
Let me try and clarify. On the one hand, you're using the evidence from the CDC and the CDC's own guidance to make a decision on whether or not to reopen the middle and the high school. But when it comes to the desk shield removal in the elementary, you're not using said guidance and not using your flexibility within it, or following any of the numerous news articles that came out, I guess, late last year and even last summer, talking about how desk shields are essentially hygiene theater, and they don't actually block anything except for large particles. The aerosols that actually carry the virus particles are free to move around the desk shields. So I'm trying to understand why you're applying one standard of following guidance and evidence for holding back on opening 5 days, but then seemingly you haven't talked to the principals yet about it, I guess. But then also not following that same guidance when it comes to desk shields.
So I have spoken to the principals actually about it. And I still think I'm following the guidance because it doesn't say that they have to be removed. So in my estimation, I'm still following the guidance, and I've conferred with our principals. And at this point, that's where we are. But again, we can certainly revisit that soon. But right now, that's where my decision is.
Okay, Adam Frisch, please unmute.
Hi, good evening. I hear you talking a lot about following the guidelines and the guidance, and I also hear a lot of parents out there confused where if we're in a county where other school districts are not following that guidance and doing things differently, how do we connect those dots? It just seems a little bit confusing. So my question to you is it a health and safety issue, or is it more of a legal issue? And I'm assuming it's probably both, but if it's a legal issue, and there are some parents that are so passionate about kids being back in school for the remainder of the year, is there some kind of legal waiver that they could sign to get the district off the hook so you can go back to satisfying the masses and everyone gets what they want? Is that a compromise that would be considered so the people who want to go back can go, and the kids who want to stay home and either do remote or hybrid can do that? And this way people get what they want without putting the district at a liability that seems like the lawyers are really having the charge here.
Thank you for your question, Mr. Frisch. My understanding, there is no waiver that we could apply for, unfortunately. I can tell you, we've spoken to our attorneys ad nauseum in regard to what we can do and what we can't do. So I think, the short answer is no waiver. And believe me, if there was, I'm sure the board and I would certainly discuss that. As far as the masses wanting their kids back, I can tell you with certainty, when I made that announcement in March about bringing our secondary students back without the hybrid option, there were a lot of parents who wanted to keep their kids home or to have that hybrid option. So I think there is definitely parents who want to have their kids back, which I totally understand and I support. But I think we also have parents who were a little bit leery about it. But in the meantime, the charge is to get as many of our students back as possible, and we'll continue to see what we can do to make that happen.
Okay, Carrie Gannon, please unmute.
Thanks very much. Appreciate it. And to kind of bring some of these strings together, one, I do appreciate everyone's focus, but I think one of the things we can all say is we've seemed to have flip-flopped quite a bit this past year. We put out, proposals, they haven't worked. I guess in terms of where we are now, what is your timeline for all of these decisions? And, what will be the timeline over the summer to communicate decisions in advance so parents can make informed decisions about whether or not to, continue to have their kids in the school district or not?
So as far as the remainder of this year, I'm looking sometime toward the end of this week for the remainder of this year. And our goal is before school ends, as far as what our plan would look like for September. As far as the flip-flopping, and believe me, I've taken it on the chin, and rightfully so, with some of the decisions that have been made. But I have to say, for what it's worth, I really believe our board and I believe our administrators, we've tried, and I think we've done a really good job since what's happened in the summer. I think we've really done, and our teachers have done an incredible job with all this difficulty throughout this year. But as far as the planning is concerned, for September, our goal is to have something out there before the end of this year.
Tracy Rogowski, please unmute.
Hi, I have a question. I'm not sure how this applies to the middle schools and the high school, but for the elementary level, my son was quarantined. This is today from Monday. This is my fourth quarantine, I think, fourth quarantine since the beginning of the school year. And I'm wondering how, if this is something that's being evaluated, if the kids are 6 feet apart and they're in masks, and my child wasn't in this situation near the child who was infected, he's sitting on the other side of the classroom. Why are we looking at this at something that we don't need to continue to quarantine the entire class for one case when there's been no transmission in any of the classes? And it seems that other districts are evaluating this and treating it differently. They're quarantining part of the class, maybe the kids at the, certain, the children are near. And I guess I'm just wondering if this is something that we're looking at.
So I'm going to ask Dr. Allen if you wouldn't mind just answering that, since you're in contact with the DOH every day.
Sure, not a problem. Yes, it's something that we certainly review our situations every time something comes up with the Department of Health. And I think, unfortunately, like we've talked about with many of our things tonight, there are multiple layers. The major concern that we have at the elementary level for us is the amount of time the same group of students spend within that classroom, interacting just in that classroom all day long, and being closer than 6 feet. So the guidance that we get about close contacts is closer than 6 feet for more than 10 minutes with or without a mask. So that mask piece doesn't even really figure into it. But it's certainly something that we continue to keep an eye on as the cases come up and discuss with Department of Health.
Leslie Cohen.
Hi. So I just would like to say that to Dr. Hines and everybody at the Board of Education, I myself own a business, and I understand that you have to pivot all the time. So I do appreciate that. But as far as the flip-flopping that went on all year, my question really has to be is when are we as a district going to learn to live with this virus and not be paralyzed by the guidance? If the other school districts are not getting into trouble, then why aren't we going to push the envelope? When are we going to put the students and their mental health first? That's my question. When are we going to be being scared by this?
So I would say before this change, April 9th, that's exactly what we were doing. We were, and still are, very concerned about the mental health of our kids, which is why we moved in this direction to bring them all back. But I think for someone to suggest that we shouldn't follow the guidance or follow it to a T, I don't feel comfortable doing that. And I look at the other districts that have been in this position. They already transitioned or in the middle of transitioning their secondary students back. They aren't in the position of where we are, where we were thinking of doing it, we were planning on doing it, we were ready to operationalize it a week after, or close to 2 weeks after this new guidance came out. It's a much different position to be in. So as far as, not caring, I'm not saying that you're saying we're not caring about the kids. Of course we do. That's why we're spending so much time trying to figure out, I don't want to say is, Dr. Pernick said, or maybe somebody else said, poke holes in it, but we're looking at it from all different angles to see what we can do. And I still think there is something we can do. And again, that answer will come in short order.
Paul Fox has another question. Paul?
Hi, thanks. So I'm not sure what the precedent is on this, but in the 16 years I've lived in this school district and my many more years of life, this seems to be the most important issue. Getting our kids back to school seems to be the most important issue any school district has that I've been involved in has faced. And so what I'm asking you, Dr. Hines, is can we have a community vote on whether we follow the guidance or not, whether we can get the kids back to school in some other creative way? And if your answer to that is no, then I'd like to know why not.
So I believe it is important to survey our staff and to survey our school community if this is possible. Not with a thought exchange, but would you feel comfortable? Whether it's before the end of this year or whether it's as we're thinking of next year. But that feedback is important, and we will certainly send out a survey to our staff and to our community in doing so.
Michelle Lang has another question.
Hi.
Oh no, it's Bill now.
Yeah, yes, it's me now. Sorry, Bill Lang. Earlier in the call, somebody had asked about September and what your plan is for getting people, or when there's or what your prediction was for September. And you mentioned that, well, you think we probably won't, hopefully not be in a red zone at that point, and so we can get the kids back. I mean, I would really, given that we're a year into this pandemic and we're in a red zone, would hope that the district is planning on the fact that, yes, we probably will be in a red zone. And if we are, what is the plan to get us back in? Like, I think we need to plan for the worst to get the students back into school and not hope that there's just not a red zone.
Yeah, I want to be clear about that because I don't think that's what I said. I'm hoping, and there is no plan. We will be meeting as with committees before this year is over. If there's what the worst case scenario is, what the best case scenario is, and to have that plan and to share it with our school community. So of course we would have something in place if we're still in the red zone come September, for sure.
Okay, it might be Matthew, it might be Jackie. Please unmute.
Thank you, Emily. It's actually Matthew again. Again, Dr. Hines, I appreciate you're answering all these questions, being peppered with different topics, different people's individual concerns. I don't know if anyone from the school board is able to respond in terms of this forum. Again, I'm concerned, and the last person just raised the issue of next year. We have a budget vote coming up next month, along with the board elections, and the community does have the opportunity to vote and make decisions on how we're going to be impacted next year. And again, we've gotten no feedback on what the budget's going to look like, what the alternatives are going to cost the community. And again, going into a potential worst case, better case, great case scenario for next fall, I think the community is going to need to know how our budget's going to work for that, for those various situations to get all the kids back in school or have alternatives that are going to give our kids a first-class education.
Beth, do you want to answer this? Beth, I don't think she can hear me. Well, Nora, do you want to? I mean, the question is to a board member. I can. I'm going to speak. I'm unmuted. So I'm just going to keep going. So Matthew, right now, the budget that we have in place that we've presented to the community, and we are going to HSA meetings and going over any sort of questions. So I don't know what school your kids are at, but I don't know if you've had a chance to go, but there will be a parent council meeting that will be open to the entire community. But we are planning our budget for 2019. So our plans are that we are bringing in all our students. Right now, the budget we've presented is putting all our programs back in place the way they were running in 2019, and all our students back in the building as if it were 2019. The planning that we're talking about that the administration is in the process of doing is what if we can't do that? So the plan is to go in as if it was 2019. Hopefully by the end of the year, we will have a backup plan in case it's not. And that's the way the budget right now is presented. And that is the budget that we've presented, and hopefully the community can stand by. Did I answer your question?
Yeah, I think it did. Thank you very much.
You're welcome. Oh, I'm still doing that. Okay, Jordan Wolf, please.
Hi, thanks for having me again. I want to speak to something that Leslie Cohen mentioned earlier. She asked about the students' mental health coming first. Considering that we can't have the preferred option of having everybody in the buildings, I'd like to hear a bit of the breakdown in policy of what is being done to prioritize the mental health of students who are fully remote, students who are hybrid, and what the plans are for those students now and in the future. I'm going to add a couple of things into this, so take notes. The first thing I would say is that at the last meeting, I asked about the breakdown of by race of families in remote. I haven't received any answers regarding any of that yet, but I believe in the light of violence against Asian Americans in last several months, and how this is actually last year, and how it's been on the rise. It's very hard to extricate and separate why families are staying remote from issues that are specific to race and specific to their experiences of, frankly, experiences that the board members do not share, because none of you are people of color. So I'm wondering how we are canvassing and finding out from the community what these issues are, of why they would either stay remote, what the mental health issues are that are affecting our students, and how we are addressing, with more than just a fireside chat, we stand by our Asian neighbors, with concrete measures to show and educate the community around the issues that our Asian American neighbors are suffering through. Thank you. I'll wait for the answer.
Well, thank you for that question, or questions plural, wrapped up into one. What I can tell you is the purpose of tonight is to focus on the Department of Health guidance. So as far as answering the questions related to, not that it's unimportant, the mental health of our students, or of course the heinous crimes against our Asian American friends and family members and community members, I can tell you we have an update with our mental health at a board meeting very soon, where Dr. Mioli and our guidance team will unpack some of the things that we've done this year and what we're focusing on for next year. So we can answer that question at a future board meeting. But for everything else, I think that those discussions can take place at a different time, as the purpose of tonight is to focus on the DOH guidance and how that's impacting our ability, or inability, I should say, to bring our secondary students back.
But she didn't call me.
I think she was muted, Ms. Perry.
Okay. I was thinking, moving forward, if there's any thought giving to students who have 504 plans or IEPs, have been struggling this year. And I was wondering if anything's going to be done next year, assuming if we have to be hybrid or not in school as much, because it's very difficult for children who have IEPs and 504. This year was pretty hard on them. So I'm hoping that there'll be some thought for the special needs children.
So in relation to what we're trying to do to bring all of our kids back, yes, and regardless of whether our most vulnerable populations are struggling, certainly our students with IEPs and 504s have had a very difficult road for sure. I can tell you with the federal monies that are coming in, or we're looking to have some extra programs over the summer that we're looking to focus on. I know Dr. Allen and her team is looking to do that. And then of course, focusing on what we're doing for next year as well. But they're always in the forefront of our mind. And we believe the experience will be much better than it was this year. You're muted, Ms. Bays.
Oh, there you go. M.A. Fox, if you could please unmute, but give us your full name.
Hello?
Yes, we hear you.
Yes, hi. My name is Marissa, and I know a lot of people have been very curious if the district has thought about giving children the option to live stream for the last 2 weeks in June of school due to any summer plans, sleepaway camp, regular camps. I know other districts are letting their students do this.
We haven't discussed it as a school district, or I should say as a team yet, but we'll certainly address that and make that public shortly.
Thank you very much.
Okay, so Michael Frivola has another question. Oh, I should allow him to speak. Sorry, Michael. Go ahead.
Oh, if my wife only had that mute button.
My favorite job.
Anyway, so I was just kind of following up on what Ms. Cohen was saying a little bit earlier. I'm an assistant scoutmaster with Troop 7 here in Port Washington, and we have actually been holding live meetings as far back as the second week of July last year. And we're talking about between 40 and 50 scouts, in some cases over 50 scouts at these meetings. And we've done it in a variety of fashions, in some cases outdoors. When it got cold out, we finally wound up going indoors into the congregation hall. We've gone on multiple day hikes. We were up at Bear Mountain for 12 hours this weekend. And the point being is that we've got kids who are running from 11 years old up to 18 years old, operating together, and the kids are being responsible. These kids are, in terms of this group setting, they are behaving in a responsible fashion, and they are seeming to get the fact that they need to wind up complying with rules to make sure they're not, being irresponsible. And we have not had a single, knock on wood, event since last July, even though we've been doing meetings ever since then. And so this is meant as a little bit of a cheerleading, effort to try to say that, when we're seeing these reports coming in from the school, it does not look like we've had any type of a super spreader event or anything brought on by exposures in school. And pushing the envelope a little here, it may be a little scary, but I mean, to talk about the CDC has gone from 6 feet down to 3 feet, for example, and you've seen different things showing that there's maybe you can be a little bit more aggressive in terms of what you're doing. We have students that literally are having the last several weeks of high school going on here, and it would be a shame to be cautious to the extent of those kids losing something they can't get back for the rest of their lives. Thank you.
Yeah, well, first of all, thank you for what you do with your scouts. It's incredibly important. Certainly appreciate that. Great experiences. There is a balancing of push-pull, of how far to push the envelope with this guidance. And we are looking to push, but not extend past this guidance right now. And I know for some of you, that's not good enough. I know for some of you, you want us to potentially even not follow it, or maybe just follow parts of it. And I can tell you as a superintendent, there are parts of me that would like to do that, but I can't. I can't do that in good conscience to not follow it at this point. I just can't do it. And, not that I'm apologizing, but I understand where you're coming from. I do. I have children in school as well, and as my parent had. So I totally understand where you're coming from, especially for, and I forgot the parent, my apologies, for our 6th graders. I really do understand from 5th to 6th grade how difficult it's been for many of our 6th graders. And so we have that in the forefront of our minds.
Okay, David Goldberg.
Hi there. Can you hear me?
Yes.
Okay. I would just like to thank Dr. Hines and the board for having the courage to take the heat, for putting a pause on the all-in plan. I mean, I and my wife would love nothing more to have our Schreiber son at Schreiber back in the classroom full time. But for all the parents who are willing to ignore the guidelines and throw the rules by the wayside, we've come so far. There are many students and parents who are not comfortable returning to a school all in, and we're not before the plan, reverted. So, and with regard also just to that survey that we were asked to fill out last week, do you want your child all in? Do you want your child remote? But there was no in between. There was no, or would you like it to continue hybrid? So to that point, I'd rather my child learn well, safely, in a hybrid fashion, than to be at risk in a school that is packed with kids who, let's face it, especially at the high school level and the middle school as well, are very social outside of school, where the school district cannot and should not be in control outside of school. Let's face it. But we all know how kids behave at this age. And unfortunately, there are a lot of parents that, turn a blind eye to it. And again, we've come so far. My family personally has come so far. It would be a shame, we're rounding third base to just, proverbial throw it away. So no question, just a statement and a thank you.
Okay, so next question goes to Donna Nackman. Sorry if I'm not pronouncing it correct.
Yes, hi. I just kind of wanted to follow up on that comment. I mean, certainly we do want everybody to stay safe and to be safe, but not every child can benefit from learning in that hybrid situation. And certainly I think it's important to take every family's considerations into account. However, school is meant to be taught in person. And I do think that every effort has to be made to make that happen. I mean, realizing that this year is pretty much almost done. But my question is, next year, a plan does need to be in place. And will the district have enough options available so that if the situation is the same, have we explored every single option to be able to ensure that every student who wants to learn in person and needs to learn in person will have that ability?
Yes, thank you for that question and statement. Yes, of course, the plan is to have a plan in place and to make sure we have our kids back. I mean, that is the ultimate goal. And not only working internally within our school system with their administrators and committees, but also advocating for this guidance to change in some capacity, which I think will give us more flexibility as far as what that looks like. So it's not just the work that's internal, it's the work that's external with the decision makers in Albany, as far as what that means for the county. I can tell you I'm on with my colleagues, my superintendent colleagues, we are trying to force the issue because there are many other districts that are in our position that do not want to be in this position again come the fall. So we're doing a lot of work to make sure that happens. We want all of our kids back.
Okay, Amy Lauria, you have another question.
Thank you for taking my question. Thank you, Emily. I have three questions. One, would you consider having hybrid as a viable option if you allow the kids to go all in, similar to what they did in Roslyn? It might help maintain 6 feet. And also I'll forget the other question. A second question is, would you be willing to give a survey out or some kind of thought exchange regarding taking the temperature of parents giving their kids the vaccines before September for next year, especially if they open it up for 12 and younger?
I just want to be clear about the second part of the question. You know, would we ask our parents if they would feel comfortable with their students, with their children, I should say, receiving vaccines? Was that the question?
I would take the temperature. The
Okay.
way I would do it is, if they come up with a vaccine for kids that are 12 and younger, or 16 and younger, would you be open to having your child get a vaccine? Obviously, it's a very personal decision per family. But I think that would be I think it would also help make a lot of decisions, as it's kind of like piggybacking both sides. But the one question I did have was about making hybrid a viable option, at least for the end of the year, if kids decide to go all in. If you say, okay, come on back, would you keep that option open of hybrid?
So this is going to be unpopular for some. No, for hybrid. We know that there are some parents that are looking for that flexibility. And I know there are districts that are out there, because I think one of the things we've been talking about is what other districts are doing. I know other districts that aren't offering that option when they do have their students all in. And there are many reasons for that, which I won't get into right now, because I know we're trying to focus on the topic of the guidelines. But if we get there, we can certainly unpack that conversation a little bit more, Ms. Lauria, for sure.
Okay, Leslie Cohen, you have another question. I'm gonna say that it seems like we're getting repeat questions. So I guess if of the remaining 171, no one has any more questions, we might be able to wrap it up sooner. Leslie.
Leslie Cohen has left the house for the moment, so Leslie is done. This is her husband.
Okay.
Thank you all.
Okay, Mr. Wolf, you have another question. Your last question.
Yeah, I didn't realize I was limited to 3. Okay. So I appreciate having this open forum. I would appreciate hearing from anybody on my query before that I don't think I got an answer to. At the last meeting, I asked for a breakdown of families in remote. And what I meant by that was a breakdown of what are the races of families that are in remote, and whether there's more hesitancy in one group versus another. I'd like to hear from board members, since Dr. Hines doesn't seem to have an answer to this question. What is being done to reach out to the diverse members of our community to find out what their thinking is on why they would choose to stay remote? This is especially important since I just heard Dr. Hines say that he has no intention of having a hybrid option in the fall.
Larry, you want to take that on? You put your hand up.
Yep. Basically, we looked at the statistics, and they're not, the amount of minority families in remote are not vastly different than they are in the overall school population. And we do have a diversity and equity work. We're working with NYU. We have members from various communities on that committee. So we are hearing from people, and it's so you're asking for something that's already being done.
Okay, I don't have any more hands up. Wait, Mr. Wolf, do you have your hand up again? See, I said your last question, but you may have another one. Do you?
It's the same question, actually. You kind of skirted my question there, Mr. Greenstein, by saying it's work that's already being done. I asked this question at the April 6th meeting, sent emails prior to that, and still have not received any kind of response. So you're telling me that the numbers are somewhat equal, which is, nice to hear that there are actual numbers. But I'm curious to hear, since there are things like thought exchanges and such, what are the prevailing reasons that families might want to remain in hybrid? What are the hesitancies that people have? It seems to me that we have one side of the story being told today with families who want to be in 5 days. And believe me, I want my kids in 5 days, especially next year when my daughter goes to middle school. So I want to know if this work is being done, so to say. I'd like to know what are the steps that are being done so that me and other members of the community can engage with it.
Just a clarifying question. Are we talking about for next year or for the remainder of this year?
I'm talking about like right now, because families are still choosing to not come back into the buildings. I'm a teacher in Flushing, and at my wife's school, 80% of their families are remote. At my high school, 50% of our families are remote, and have no intention of changing anytime soon. And I'm curious what we're doing in Port Washington to reach out into the community, not just wait for them to come to us.
And I'm not trying to be disrespectful. I still don't understand what you're talking about in regards to, we have the current option for our secondary students of they're either hybrid or they're fully remote. That's what we currently have right now, right?
I'm not going to dispute you on that one.
So I'm trying to understand what information you're looking for that we're not providing you.
I'm curious, what is it that is the reasons? Why are families choosing one option or the other? We've heard many opinions tonight about why people would like to have their children in 5 days, and I believe they're all valid reasons.
Sure.
I think that it's just as important to find out, especially since we have no idea what the worst case scenario, as you said, you're going to plan for in the fall might be. What are the reasons why people would choose to be hesitant to come back into the buildings? And if we don't know those things right now, I'd like to hear either an acknowledgement of that or a plan beyond it's going to happen and it's happening. What is the effort being put forward by the district to reach out to everybody who is in these communities? And I shouldn't just say, families that are remote or hybrid. I mean, there are, certainly a diversity of people who have their children in school and have had their children in school all year. The reasons for choosing that are, I'm sure, very different. So I would like to know, what do we know about this?
Mr. Wolf, I'm going to just chime in and say one thing with regards to your questions. We did mention, I think earlier, that the high school had sent out a survey asking whether or not students would be coming back. The middle school does have that plan as well to send those questions. So we will have that information as far as how many students feel more comfortable coming back or not. I think we all know the answer is that there's probably a lot of factors as to why students may not be feeling comfortable coming back into school, whether it's their own personal situations, their family situations, or whatnot. I mean, it is a goal, as we've all said, to get all our students back in the building. So I think we are working on getting that information. And I think what Mr. Greenstein said to you is that in our school district, I know you keep referencing to your school district where you teach, but that is not the case in our school district. We don't have a disproportionate amount of students that are a diverse population that are staying at home. It is spread out evenly for us. So I think we can probably, once we get the information, solid information on the high school numbers and in the middle school numbers, I'm sure that information will go out through the schools and it'll be communicated to the rest of the community. We have one more question, and that is Bill Lang, but it could be Michelle Lang. So I'm going to allow that. And I think after that, that'll be our last question for this evening.
It is Mary Catlin, and I just want to say I really do appreciate it. I wanted to say thank you to all of you for listening to our questions and to appreciating the fact that really our only motivation tonight is to get all of our kids back into school. As a teacher, I know the only best way of learning is to be face to face with the student. I know when they are learning something. I know when they're not learning something. I can help them better face to face. And I really would hope in Port Washington, we would really put that as our forefront. And I know that there are limitations, I get it, but the best mode of learning is to be face to face. So I would really hope that as a district, we would put that as our, best face forward and get them all back into school. They really need it. And I really do thank you for everything you've done. And I hope that we can really put this in the book as like recognizing it's been a really trying year, but we know what our kids need. And I know what you know as educators, your students need. So thank you.
I agree with you.
It's a nice question to end on. Thank you.
I want to thank everybody for coming tonight and for your questions. I want to thank Dr. Hines and all the administrators and thank the board who's been here too. And I'm very glad we had the opportunity to hear the community. And I want to say, as you know, we are following up, and as soon as we have more information, it will be communicated to you. And again, thank you for sharing your thoughts and for your questions. We appreciate it. And to all, I'm going to sign off and have a good evening.
Good night. Thank you, everyone.
Thank you, everyone.
Good night.